Good afternoon. My name is Jeanette Magnus, and welcome on behalf of the Center for Global Health to all of you for this exciting seminar on menstrual health, a global challenge. We are looking forward to an interesting presentation from several panelists and also discussion following these presentations. And I'm delighted to introduce to you Professor Kari Skjelbrekke, who is the lead of the Gender Crossing Theme at the Center for Global Health. So please enjoy and post questions in the Q&A, and welcome to Kari and to the whole group of panelists.
Thank you, Jeanette, and thank you all for joining in today's webinar focusing on menstrual health, a global challenge. And in short, why this topic today? Let me start by some numbers. More than 800 million people across the globe menstruate daily. And we do though know that in many regions, people are considered dirty or impure during menstruation. And women especially may face certain restrictions from school or prohibition from social meals or specific foods, as well as being in contact with animals, on board boats or socializing with boys and men. And while the concrete challenges might be different, menstruation is still met with silence, lack of knowledge, and shame also in many high-income countries. Although being part of so many people's lives around the globe, it is also a fact that the day-to-day experiences of menstrual health are only just beginning to be researched and understood. Additionally, the impact of the COVID-19 pandemic on period poverty is also part of this growing recognizing process. And as addressed by an increasing number of organizations, political actors, and scholars, the impact of the pandemic are gendered. We know that now, with especially women bearing burdens like high unemployment, increased childcare and home responsibilities, and worsened mental health. And for those experiencing period poverty, the lack of resources, like access to free products or products at all usable, it is a problem that has worsened by the pandemic. And we also know that in war crises and in refugee camps or refugee situations, this is a huge problem for those menstruating. And on this background, the Center for Global Health and as well Women in Global Health Norway are excited about this webinar coming through. And we hope it will contribute to the relatively new public conversation about menstrual health, and as in this webinar, particularly focusing on what role shame and silence might play globally in the context of menstrual health and how these barriers might be tackled in the future. Because no person should have to experience social exclusion and shame due to their period, or feel that their period holds them back in any way. So, in order to shed specific and updated light on this issue, we are very happy to have a distinguished group of speakers with us today. A warm welcome to you all for taking part. And now I'm very honored to introduce our first speaker, Dr. Jennifer Martin. Dr. Jennifer Martin is an award-winning global health professional with experience leading programs, research, and advocacy initiatives across the globe. And in 2020, she founded the global collective of activist pandemic periods and support her team across 21 countries to further menstrual health in their context. Jenny has spent the last 8 years voluntarily leading projects that focus on menstrual health and gender equality. She is a public health and advocacy expert in her day-to-day, but dedicates her free time to furthering menstrual health in her native Scotland and supporting activists, as I said, around the world to share their knowledge and expertise. Jennifer has a PhD in public health from the University College London and also has a master from the London School of Hygiene and Tropical Medicine. So by the title Menstrual Health, a Global Health Issue, The word is yours, Jennifer.
Thank you so much, Carrie. Can you hear me? Oops.
Yes, all good.
Yeah, you can hear me. Okay, great. Thank you for that introduction. I think I need to work on reducing my my bio. It's getting longer all the time. So first of all, I just want to say a big thank you to Women in Global Health Norway and to the University of Oslo for putting on this fantastic event. I think in the last couple of years, the traction on menstrual health, I mean, it has been gaining traction on the global stage. Myself, as Carrie had alluded to, I've been working in this space for 8 years now, and it has just fantastic to see that people are starting to sit up and take listen and appreciate that there are a lot of drivers behind poor menstrual health rather than just access or affordability of products. So today I'm hoping to share some of those with you. So that's me. I think I've already had a fantastic introduction, so I don't need to tell you much more about myself. Some of the work that I've done previously. So I started working and volunteering around menstrual health back in 2014 when I was at London School of Hygiene and Tropical Medicine under a very fantastic and brilliant professor, Val Curtis, who was head of the Hygiene Centre. Now, unfortunately, Val Curtis actually passed away last year from cancer, but she has still always inspired me, and we did keep in touch up until that point. So when I first spoke to Val about menstruation, Val wanted me to look at doing my summer project around looking at spaces and seeing how spaces could support women's menstruation and adolescent girls' menstruation in parts of rural Kenya. Now, at the time, I thought, oh God, I really don't want to do something in menstruation. And that made me really reflect myself on what my own biases were and how I was part of the problem of further perpetuating stigma and shame because I didn't feel comfortable talking about it myself. It also then made me reflect and think, if these issues are happening in these contexts, they're probably going to be happening elsewhere, and it should really be up to me to look at it within my own country of Scotland and see what we can potentially do to try and address poor menstrual health in Scotland itself. So some of the work that we've done over the last couple of years, I was part of the group, or I led a group of activists that managed to get free period products at our football club. Now, one of the really interesting things about this project was, if we think about menstruation through a gendered lens, usually it's girls, it's adolescent girls are receiving that reproductive health information in a lot of contexts. In many, many contexts around the world, boys and men aren't as involved as they should be. And then what happens is that you get these patriarchal norms and values which are further perpetuated because there's a lack of understanding, education, or information around menstruation. Policies can't be made through a gendered lens because people don't maybe understand what the drivers are. So our driver for getting Glasgow Rangers Football Club to provide free period products, it wasn't just about the accessibility of products. Anyone should have their basic needs met. Everyone and anyone should have their basic needs met when they are in any situation in the workplace, in education, going to watch their football team play. If you were a man, you wouldn't be expected to pay for toilet roll. So I certainly did not expect to pay for period products when I was watching my team. But the other main driver for me was, it is such a patriarchal stronghold, and to bring the conversation into a space which is predominantly men, which is very traditionally male orientated, a football club, to have a discussion about that and to change people's minds is something that's truly transformational. Now, this initiative was part of the On the Ball initiative, which actually started at our rival football club, Celtic. And when Celtic decided to implement free period products, me as a Rangers fan thought, well, if Celtic are going to do it, then Rangers are going to do it too. So we mobilised a group of fans, male and female, who spent 4 years lobbying for the football club, having conversations with them, having discussions, looking at how they could implement this infrastructure through free to vend machines, and then how they could actually amplify it throughout their fan base. Now, interestingly, last week, they have actually fully implemented it after this 4-year period. But I had a really interesting discussion with one of my fellow Rangers fans who was openly just talking about periods and menstruation. Now, this is a 45-year-old man And I'm not saying all 45-year-old men think in the same way, but he was very patriarchal in his views, and he was openly talking about menstruation, and that came from that visibility, taking the conversation to a new space. It's really important when we work in this space that we make sure that we're not in an echo chamber, that we're always challenging ourselves, we're evolving with our society, and we're thinking about how do we take a conversation to the new space so that our views, our thoughts, and our values aren't just bouncing around in the same space and being validated by each other. It's always important to go and to have a conversation with someone who maybe doesn't agree with your views, and maybe you'll learn something yourself. So for me, that is probably one of my proudest achievements, and it's not by any means the biggest project we've ever run, but it was a grassroots, no funding, completely fan-led initiative that mobilized a whole fan base of men to start to have a conversation about menstruation. So I was very proud of that. We then appeared on the BBC Scotland Free Periods. They were doing a programme about various fan-led initiatives and grassroots campaigns. That's me sitting on my couch in my living room with my fellow fan there, talking about the initiative. And a lot of the other work that we've done around the world has been bringing that conversation into a new space. And you can see in the bottom corner there, I was also part of the group of grassroots advocates that really advocated for the Period Products Free Provision Scotland Act, which I'll talk about a bit later in the presentation. So back to pandemic periods. Now, one of the reasons I wanted to start an initiative like Pandemic Periods is building off the back of some of the energy from what's been happening in the gender equality space, in the women's movement space, but also in the menstruation space. When the COVID-19 pandemic hit, we realised that, of course, women would be disproportionately impacted by this pandemic. Their sexual reproductive health rights were largely not included in any kind of emergency programming, any kind of global health security pandemic response, never mind their menstrual health. Now, sexual reproductive health rights, menstrual health, they usually come hand in hand. But I thought that this was really interesting because, as we say, periods don't pause for pandemics. So one of the things I really wanted to make sure that we were doing was, so we're trying our best to make sure that we have that localized voice, that we are regionally diverse, that we're optimizing our diversity and inclusion practices, making sure that we're looking at these challenges through an intersectional lens, was to work with advocates within each of these countries to elevate the voices of those that were experiencing period poverty or poor menstrual health during the pandemic. We're actually currently working on a book where we have collected stories of people, again, looking at an intersectional lens. So for example, in Nigeria, we looked at women with disabilities. In parts of South America, we looked at Indigenous women. What were the challenges? What made that exceptional for their locality? And how do we think that they could overcome it in the future? In my native Scotland, we had a look at homelessness and homeless women, and we also had a look at menstruation of healthcare workers. Healthcare workers, of course, being on the front line of our National Health Service. 77% of healthcare workers are women in Scotland, and yet they don't provide free period products for them. They are starting to have conversations around it, but our emergency response to the pandemic, the last 2 years, the women weren't getting the time, they didn't have the spaces, and they didn't have access to the products. And I should say women, trans men, non-binary individuals that were working in the healthcare on the front lines of the secondary care and the emergency response in Scotland weren't able to attain their menstrual health. And there was a lot of reports about poor menstrual health because they didn't have what they needed to do their jobs effectively in their minds. So as we kind of touched on earlier as well, what we just found unbelievable was the fact that menstrual health is not being programmed for, it's not being considered in global health security, it's not being considered as much in emergency responses, though we have had some fantastic initiatives from the UNFPA about them, handing out dignity kits. There needs to be menstrual health mainstreaming because we have 1.8 billion people menstruating every month. And when I say people, again, I mean women, adolescent girls, trans men and non-binary individuals. And yet 500 million of those each day are not able to attain their menstrual health. And when I'm talking about menstrual health here, so In 2021, we finally got our definition of menstrual health, and a lot of people said they weren't entirely sure why this was going to be relevant. And what I really think it did was it did kind of bring to the forefront the importance of having a definition, being able to have those the papers, the academic research to prove that this isn't an issue. We know what it's like trying to get funding in this space. We know what it's like trying to get funding for research, never mind women's movements. We need to have the sector slightly professionalised so that we do have the base and the evidence to be able to go forward and to get that funding. And so this was just another highlight, another opportunity to gain visibility for menstrual health. And what I really like about this definition is it is akin to the menstrual health, the health definition. So I feel like I'm not even halfway through my presentation yet. I'm very sorry, Carrie. So yeah, and the opposite of that would be period poverty, the period poverty definition. And one of the reasons I like the period poverty definition is this actually emerged from grassroots movements. And it talks about not just period poverty. When we think about it as a paradoxical term, and you could say that it does actually further perpetuate the stigma and shame surrounding menstruation. Whereas I would say it kind of does the opposite, because without us understanding that poverty is going to be one of the main drivers for poor menstrual health, then how can we design initiatives that are going to address them? When we think about menstrual health, it's obviously about access to information and education so you can manage your periods with dignity. But it's also about spaces. If there's infrastructure in place, is there going to be water? Is there safe and discreet disposal? Are the spaces secure? Are you going to come to any harm when you're in the spaces? So all of these, coupled with the affordability and accessibility products, is menstrual health, and the opposite, I would say, would be period poverty. I've just touched on some of the drivers there, but what I wanted to do was to show this across the socioeconomic model, because I think that sometimes we think about it very much on an individual or a policy basis. Like, I think of policies, all the fantastic policies, this movement emerged from Kenya, where they removed the period pink tax back in 2004. We've had the criminalisation of the chowpatty practice, the period huts, back in 2013, I believe that was, with Nepal. And we've since had some really very transformational and innovative policies that are trying to push the menstrual health agenda across the world. But I think that this spans across all 5 levels of the socioeconomic model, down, from the individual who actually may be experiencing poor menstrual health, through to environmental factors like, do they have municipal services that are going to collect disposal? What do we do, for example, if we are giving out reusable products in a place or a space that doesn't have access to water, or there's a water shortage, or they don't have access to a washing line? Are we then further perpetuating the stigma and shame? So we do really need to think about integrated approaches, and we do need a diversity, and we need a toolbox so that we can address some of these challenges relating to menstrual health across all levels. So these are some of the things I think we need to do to overcome stigma and shame. One of the most important things, I think, is elevating the voices of grassroots advocates, because I think that only they have the one-on-one first-hand experience of working in their context. We need comprehensive sexual reproductive health education that includes information for boys and girls, because often there's a lot of gender bias, because again, the girls are receiving the information, the boys aren't. And we need, of course, like programs and policies that address menstrual health across different areas. We need cross-sectoral collaboration. Everyone needs to be talking. It's important that we think about bringing the conversation into new spaces, as I've previously indicated. And we need better financing and teams, because a lot of the multilateral organisations, they don't have full teams that are dedicated to menstruation. They may have one person, or they may have somebody embedded in the sexual reproductive health teams, and that's just not good enough for 1.8 billion individuals that are menstruating. I was going to touch on this policy, but I think you all know about it, and I'm happy to share my slides, but I'm just going to very quickly say what we've been doing at pandemic periods to overcome some of these challenges. We do a lot of compelling thought leadership, working with, for example, people from Columbia University, elevating the voices of our grassroots advocates and helping them to get published. If they have an idea or they have a challenge in their context, I work with them to write something. And then we think about how to get it published. So we go through the end-to-end process, which is meant to upskill them as well as giving them visibility. It comes from the places like Lancet right through to platforms like Think Global Health. And one thing I also want to say is we do need to diversify this conversation, because although we do appreciate that the majority of people that are menstruating are women and adolescent girls, not all women menstruate, and not all people that menstruate are women. And we wrote this article for the Lancet talking about exactly that, and why we need to be having more inclusive conversations, which really want to make sure that everyone can attain their menstrual health. We do have had various scholarships for some of our representatives from various countries to get them accredited in their Columbia Menstrual Health in a Global Context course. We run participatory workshops so people can learn how to build strategies for their own organisations. And we also host global discussions like this. So I also run as a kind of my side hustle is doing workshops with private sector organisations so that they can address menstrual health in their workplaces, because if you want more women in the workforce, if you want more people that menstruate, you need to make sure their basic needs are met, and that starts with having period positive workplaces. So we've just also created this new knowledge management platform that's open for grassroots voices to share their insights. And I'm just going to pause there and leave you with that. So thank you very much, everybody. It's been a pleasure. I think I've gone over my time, and I could talk all day about this. So if you're ever interested, you can get in touch with us here. And thank you very much. I'm really looking forward to the rest of the discussion.
Thank you so much, Jennifer, for opening this webinar with such a distinguished and very inspiring, and also showing us a lot of possibility and pathways to work on this issue. I think I would just open up for one question. There's somebody here asking how to address schoolgirls and boys in Kenya to menstruation. Do you have a keyword for what could be the icebreaker to normalize menstruation?
So with adolescents, I think, so when I was doing some work with for the Gates Foundation, we worked on a project called CORE. We did some work actually in Kenya, Nigeria, Tanzania, and India. And what we actually used is we used dolls. We made paper dolls, and we used a human-centered design approach. And that was one of the things that I wanted to touch upon. We don't always have to do didactic health message giving. It doesn't always have to be in that format. It can be within focus groups. You can use tools to get them to think about the challenges. And what we had is that we had a character who we created. In India, she was called Rani, and I'm sorry, but I can't remember the name of the other ones. And we took them through Rani. When Rani would go to the market, what would she do? What would happen if, for example, she was being teased by boys? Or what would happen if, for example, she got her period? And we got the girls and the boys to do in separate groups to go through it and to help them think about what the challenges would be. And then each stage, so each place that they went to, we would have like a different health message. So one of the things I do think is really important is to make sure that the tools that you have are contextualized, whatever they are, and that you can try and have an iterative discussion, because I think that adolescents are a lot more intuitive than we may think, but what we want to try and do is make sure that we're not instilling any kind of gender bias in them, because we're not educating everybody equally and thinking about women's and men's health. And it's that opportunity that we have to craft their knowledge and expertise. So I would say think about using some design research tools, because we felt that they were really beneficial to getting a conversation going.
Excellent. Thank you so much. And again, for your presentation. I guess we will come back to several of the input you gave us. We'll move on in the program, and the next speaker is, I think, situated in Nepal at the moment, and that is Liv Endel. Liv is a nurse, midwife, and development practitioner. Sorry, and she works as a United Mission to Nepal, and she has been doing this since 2015, first as advisor in a 5 years project in far west Nepal related to traditional practices that are harmful to women and girls. And she's now working at Okalunga Community Hospital in the eastern part of Nepal as a clinical educator at the hospital's nursing college and maternity ward. So her title is Menstrual Health Experiences from Nepal. The word is yours, Liv.
Thank you. I'm excited to be here. Can you see my screen now?
Yes, we can.
Yes. So hello from Nepal. I will share some experiences from a project I worked in far west Nepal, as Kari said. So Nepal is a small country between two giant neighbors. We have China to the north, and then we have India to the south and east and west. So Nepal is very diverse, and so my experience from the far west does not represent the whole of Nepal. So this was a 5-year project I was involved in with the focus on combating traditional practices that are harmful to women and girls. And our aim of this was to create the society where there's more equality between girls and boys, and that girls are also given the same value and opportunities and rights as boys have. And so one of these practices that we focused on was the practice of chaupadi, which is basically that girls and women are isolated or excluded during menstruation or after childbirth. And it's based on the belief that a girl is impure when she has her menstruation. She's untouchable. And so it's practiced in different ways, but those that are more strict, they practice that the girl has to sleep outside in a shed, which they call chaugot. So this is one of them. They also have to eat separately from their families, and there's certain food that they cannot have, like especially milk and yogurt. They cannot go to the temple, or they cannot worship, and they must use a separate water tap. So like in this picture, I don't know if you can see it, there's 3 different water taps. So one is for so-called higher caste people, and one is for so-called lower caste, and then the tap closest to us is for women who are menstruating. The first time a woman has, or a girl has her menstruation, is the most strict chaupadi, and she has to stay 14 days in the chaugot. She cannot see the sun, and she cannot see male family members. And then later periods, she should stay for 4 to 7 days in the chow shed, and also after childbirth. As long as a woman is bleeding, or at least for 11 days, they would practice chaupadi. So because the woman should not see the sun at least the first time, so there's no windows inside the chow shed. It's very dark. And the belief behind this is that a woman would, because she's considered impure during menstruation, and if she comes into the home, she would pollute the home, and then the gods would get angry and they could impose harm on the family. So crops could fail, or animals could die, or water sources could dry up, or people could get sick. It's very unpredictable what will happen, but something bad will happen. And this obviously deeply affects girls' physical and mental health. And there are reports of both snake bites and sexual violence and even death in those chow sheds. And also the psychological effect of being considered dirty and impure is also this powerful force of keeping women on the margins. So chowpatty is outlawed in Nepal. The last law from 2018 completely bans the practice of chowpatty. So those who practice can be liable for imprisonment for 3 months or a fine of 3,000 rupees. As far as I know, no one has been convicted based on this law, but that is still important because it shapes people's opinions about the practice. And what we found also is that to make change, it's important to involve the older women, especially. They are the holders of tradition. So it's not the men imposing this. It's often the older women who are the strong tradition holders. And then younger girls are often ready for change, but they can't do anything if it's not approved by these older women. So we need to involve them, the older women, also the men and the young people, and then we also involve the religious leaders and media in our work. So we worked in groups, discussion groups. That was our main strategy, where they would discuss about their own situation and what they wanted it to be like, and then how they could make that change happen. And then change actually did happen, what we found both in people's attitudes towards the practice and also in their actual practice. And when we started, we thought maybe we'll find some single change makers who would be brave enough to change. But what happened in the end was that whole groups would change practice. And that was a more sustainable way, where it's not one person having to carry the weight of, if something happens, she would be blamed. But then if the whole group would make changes, then they shared the responsibility, kind of. So there was a lot of change happening in the practice. This is a picture of a village called Moragao, where previously the whole village was, women could not enter it when they had the menstruation. But after they started these groups, and they would have group meetings at different people's houses, and they decided they would enter that village and have those group meetings whatever time of the month. And then they found that nothing bad happened, after they entered the village, even if one of the women or some of the women would have menstruation. So change is possible. Yeah. Thank you.
Thank you so much, Lee, for sharing your experiences from Nepal, which, of course, the traditional practices, of course, is quite disturbing, but also it's very nice to hear about the positive changes you are working on. So thank you very much for your speak. And now I assume we just go further on to the next speaker, which is situated in Norway. This is Agathe Våge, who is our next speaker. She is the deputy leader of the Socialist Youth Party in Norway and former leader of the School Student Union in Norway. And her goal, she told me, is to make the world a better place. And currently she studies law at the University of Oslo in her 3rd year. And women's human rights is an issue close to her heart. And she has specialized in this area through her studies. Today, she will tell us more about how especially the Socialist Left Party youth organization has worked on menstrual health. So the word is yours, Agatha.
Thank you, Kari, for that lovely introduction. I'm looking forward to talking a bit about our work today. Now let's just share screen. So if I do this, do you see that the slide changes? Great, thank you. And thank you for the attention. So our goal in the Socialist Youth Party is to create a world where everyone is free to do what they want, and an important part of doing that is to have a socialist and anti-racist and feminist policy. And free sanitary products is actually a quite important step in the direction of ensuring women's liberation, also here in Norway. But first, I want to talk about why sanitary products being free is important, and both Jenny and Liv have talked about that. And earlier, I think that their presentations were very powerful. I had a strong emotional reaction on it, at least. But yeah, why is free sanitary products for women important? Well, first of all, you can you can do the math, and you can sum up around how much will women spend on sanitary products here in Norway. And a calculation says that it's around 70,000 Norwegian kroner in a lifetime, and that's actually quite a lot of money. But you can also turn the question around. It's why should women pay for sanitary products? Because as the former speakers have said, menstruation is connected to taboo and shame. You can feel impure and not like a fully human being. And having free sanitary products may normalize having a menstruation. It may take the edge of the taboo and the shame. So that's why we have worked a lot in my organization to have a campaign on free sanitary products. And our members, they are in school. They are around 13 to 18 or 19 years old. And this is an issue that is very close to their heart, because many of them remember very well the first time they had their period. It was very scary and they didn't know what to do. Maybe they were at school and there wasn't any sanitary products there. So maybe they had to find the teacher and be very embarrassed and kind of, please, could I have, I'm bleeding, what do I do? And by having free sanitary products and also having them at the schools, that might, again, normalize having a period. You know, half of the population has it once a month. And as it was said, at any time, any day, there's always someone having the period. It's very, very normal. So why should we feel the shame and taboo around it, you know? So free sanitary products and having it at the schools will be important to, yeah, be like, oh yeah, I just have my period right now, you know, that's not a big deal. So it's very important that also the schools help young girls. And I think studies show that girls in Norway have the periods earlier and earlier. So now it's quite normal to have it when you're around 9 years old, I think. And the schools don't have bins in the toilets, so it's very obvious if you have the period. So yeah, free sanitary products and also the things that follow that is important. And also, you know, given all the negative side effects of having your menstruation, your tummy hurts, and you have mood swings, and you feel a bit weird. I mean, so I think also free sanitary products is just like a necessary compensation, because it can be quite annoying having your period, and you know, you can't wear your white pants. I mean, I know it sounds very shallow compared to the former speakers here. I really know that. But at the same time, this is a part of women's liberation. It's a way of living your life the way you want to and feeling free to do what you want to. So though I know it might seem like a luxury problem, it is a real problem, and I will show that this is something people care about. And also there are many countries that have made sanitary products free, among others Scotland, Kenya and South Africa, and also some cities and states, and some have only removed the taxes from the sanitary products. So I'll show you some pictures of our campaign. So this is a Facebook post from 2020, and it says it should be free to bleed, and that was a post that created a lot of engagement. You can see that it's not that you should care too much about likes, but if you compare this message to other posts we've had, it's around 3,000 people who reacted to the post and over 200 comments, and that's a lot in a Norwegian context. It's not normal that the youth parties have such a large engagement to our posts, and you can compare it to actually a Ukraine post that we posted recently, and I use this example because we know that Ukraine is a very important issue for people, of course, because of the war, and people showed a lot of engagement, but still it was around 800 people here who reacted to the post compared to almost 3,000. So I think that's quite interesting to compare how this message really gets out to people who don't necessarily are on the left party side or vote for our party, but still they care about this issue. You can also see on Instagram, it was a lot of people who reacted to the post, around 1,400. And if you compare to, for instance, Palestine, which is an issue that also is very important for our members, it was only around 400 people who reacted to it. And again, social media isn't always the right place to see what people mean and think, but after I have I've been running the social media in the Socialist Youth Party for 2 years now, and we see that every time we post something that has to do with free sanitary products and that it should be free to bleed, it is something that people care about, regardless of which party they vote for. And I think it's in Norway, where we have such a good welfare state, it should be very easy to make sanitary products free. And it is very important for women that we remove the taboo and that we don't have to use money for it. It was also a study that was done in England and Wales that showed that around 1 in 4 had skipped school because they couldn't afford sanitary products. I don't have any numbers for Norway, but maybe it's the case here as well. And again, I think our slogan is very good. You shouldn't pay money to bleed. Thank you very much for your attention, and please feel free to contact me at any time. You have the contact information there, and I'm looking forward to the rest of the seminar.
Thank you so much, Agatha, for your lovely presentation and very engaging talk. I think it just reminded me that I think when I was at your age, it was much more better access to these kind of products at schools and gyms as it is for today. So maybe we can come back to that, but I think that is paradox in many ways. So I think it's extremely interesting to have a voice from young people in Norway. So thanks again. And I also just wanted to add in that all participants are encouraged to engage with our speakers by posting questions. So please do not hesitate. You can also do it anonymously or by name. So having said that, I would like to move on to our next speaker, and it's a pleasure to introduce Hailey Katarina Lane. She is associate professor at the Faculty of Medicine in the field of obstetrician and gynecology, and nowadays Katarina is also a senior researcher in the Norwegian Research Center for Women's Health in Oslo University Hospital. And her research topics are maternal birth injuries and adverse outcomes in pregnancy and childbirth, and she continuously conducts education and training to improve patient safety and reduce complication during childbirth. And the title for your speak is Menstrual Health and Norwegian Perspective. So the word is yours, Katarina. So you're unmuted.
There, now
Yeah.
you hear me.
Perfect.
Yes, and in addition to being a researcher, I also have a small clinical practice as a gynecologist. So this topic today is very familiar to me. We can say that Norway has maybe is among the countries in the world when the gender equality is among the best. So the problems that that you presented previously in this meeting about in Nepal, for example, we are not there. Our women have much better situation, but there are interesting findings in Norway also when it comes to menstrual health. Good things in Norway is that we have sexual education that starts already at primary school, so it adds knowledge about menstrual health, and it's mandatory for all genders, and information on menstruation is a part of this. But as Agatha mentioned, even though we have access to sanitary products, they are not free. There is a price, and I think this price is notable for especially for young girls like teenagers and students. So the history of women being dirty or unclean during menstruation is old, and we can see it still in Norway too, and it creates the shame on menstruation. There is a newly published study from Norway. It was published now in May. It was a survey to 1,000 respondents, including both men and women, aged 15 years or more. And it shows interesting numbers. The female respondents answered what they are concerned for. Still 67 women are concerned for having visible blood spots in their clothes when they are menstruating. 45 women are still afraid of causing smell when they are menstruating. Almost half of them feel unclean during menstruation, and more than half of them, or more than 6%, still hide tampons and pads when they need to change it. They feel shame of the pain, and they feel difficult to talk about the pain. They experience discomfort at work if they have reduced ability to work. It's difficult, and it's extremely difficult to talk about it at the working place, that they have to be at home because of pain or other complaints during menstruation. And even buying sanitary products, 17% women reported that they feel shame when buying it in the shops, and they try to buy something else too, so that it's not only the sanitary products they have in the curve. 40% of the women have had experienced commenting their mood by others and referring to that they probably have menstruation and are on bad mood because of that. So this is a classic understatement against women. The male respondents in Norway, only 11%. 11, is it a lot or is it a little? But when they were asked if they feel menstruation is disgusting, 11% answered yes. So most of them answered no. 9% of the men experience that it's embarrassing to talk about menstruation. And 22% of the men admitted they have commented a woman's mood, referring that they might have menstruation, and that's why having a little bit bad mood. What was interesting and what surprised me as a gynecologist, that it was actually the young women, the youngest women, that reported more shame and negative feelings than the older women. Because in my practice, I experienced that women who come to a gynecological examination, if they have bleeding, they apologize. They're coming to a doctor, a gynecologist, but they apologize they are having menstruation, and that's very weird for a gynecologist because it's my work. But it seems that the younger women feel more shame about this. What was positive in this study, in this survey, was that when they had conducted the same survey for 1 year ago, and even though it's a small survey, only 1,000 respondents, but it showed improvement in all groups, in all these problems that I showed the percentage in this year was lower this year than last year. So that was very, very nice to see that there is improvement, measurable improvement around the attitudes. Then we have social media, and I'm very optimistic that the change is coming, and social media helps us in this topic too, because there are many women activists in social media, and as Agatha also showed, you can use Facebook, and there are also many bloggers who write about this issue, that we shouldn't be ashamed about menstruation, and we should be able to talk about it more. So that was my short comment on the topic.
Thank you very much, Katarina. I think this adds very well into our topic today. It shows that this is a really global issue, but also it varies between generations, and maybe there are also some more improvements in terms of shame and stigma. Although I was a little bit surprised when you told us about women coming to you and being ashamed of the blood. So I also wanted to ask you a little bit, is this really a bigger problem for young girls also, because they are living in a time where maybe the clean body is more important, and also we know that some are starving themselves in order to compete in either in sports or other areas. Is this, especially the last thing, is that also your impression?
Well, my impression is that as patients, the younger women have a more natural contact with their body, and apologies come from the older women. But this survey shows the opposite. So and there is very little research in Norway about this. Maybe we should do something around that, Kari.
I think so. I think there is time to pick up on this in a more research context, because there are so many issues related to menstruation still. Although, as you started to say, we are considered as a gender equal country in a global context. But I think this webinar also shows that there are so many similarities across the globe. Yeah.
The old myths are strong.
They are. So thank you so much for that, Katarina. It was really inspiring and make me think about Norway in a new context, in a new way. So the last speaker for today is now to be introduced, and that is Josef Noel. He is a professor at the Department of Technology Systems at the University of Oslo, and is also Secretary General at Basic Internet Foundation. Josef joined UiO as a professor in 2005, following his career at Siemens, the European Space Agency, and Telenor. And his focus is on digital transformation and societal security, with a specific focus on digital and global health, and also responsible for this as a cross-cutting scheme at the Center for Global Health. The lack of free access to health information on the internet has been a driver for him to initiate the Basic Internet Foundation in 2014, with a core focus on connecting the unconnected. So, Josef, you will speak under the title Digital Health Promotion at Schools, Reducing the Stigma of Menstruation in Kenya. The word is yours.
Thanks, Kari. And I guess you all have seen the first page, so I can directly jump over to page number 2. You know, I learned one thing, and that is, if you don't know about something, then start teaching about it. Then you have to learn. So at the Center of Global Health, we are working with digital global health. And in digital global health, we know a lot about the upstream, but we really don't know about the downstream of how do we address the people in Kenya, in Tanzania, in Ethiopia, in Nepal, and so on and so forth. And that has been one of the topics which we addressed at the Center for Global Health through what we call the digital health promotion in the Global South, where we developed the methodology to actually say, how do we reach out to people? How can we convey a message? And like when we now connected schools, where we had like 45 schools in Kenya and 60 schools in Tanzania, the question was basically, how often are girls missing out on schools because they get menstruation? The most normal thing on earth. And that has been for us the starting point to actually start this project on digital health promotion at school, to both give girls at school the opportunity to find a space to talk about menstruation, but also try to help the local governments to support the access to sanitary products. So it's a lot about information and education. And the reason why I'm here today is to tell you a bit of what we have achieved, but even more to ask you for help. So in the background, you see a bit of the study Christina Holz was leading in Tanzania, where we built up information spots in rural areas, and we informed about anthrax, cysticercosis, and we had a tremendous uptake. So the methodology, I don't want to spend too much time, is really like asking locally what it is all about, and then creating the story, and then transferring the story into pictures. And for those of you who are interested, I will afterwards post the link to some of the videos, like the AMR or the COVID or the breastfeeding information. And the question for me now is basically, yes, we are working together. I'm here at the ITU, and we are currently working together with the ITU to help in school connectivity. And like that results in that Catherine, our girl on the right side of the picture, she is in Tanzania out, has just connected 50 schools, and we are now scaling up to 200 schools in Tanzania, which gives us an excellent base for doing work. And in Kenya, we connected 45 schools with 27,500 students, and there we have like girls' schools with 1,800 girls. And when talking to the universities there, they said, hey, Joseph, let's take up this topic. So in order not to spend more time, I'm really asking you, can you give me your help in giving good ideas, arguments, the good story for menstruation, such that we can put it out into animations, pictures, which we can then build for a global outreach. Because one of the things which we learned is when we do digital outreach, we actually have the chance of translating it, contextualizing it very easily into other local languages. So that was my ask for help here, and I hope we can address that in the debate. Thanks so much.
Thank you so much, Joseph. I think this fits really well in to our aim of also discussing how to tackle the barriers for better menstrual health. And thank you all for great presentation, which I think shed light on our topic in a very interesting and stimulating way. And due to the program, we now have reached a point where responses and reflections will be facilitated by my distinguished colleague Bernadette Kumar. Bernadette is known to many of you, but let me just shortly add that she's the director of NACMI, the Norwegian Center for Migration and Minority Health, which is part of the Norwegian Institute of Public Health, and she's also associate professor at the Global Health at the Institute for Health and Society. So she has a very broad background and expertise in global health in general, and migration and women's health in particular. So please, Bernadette, would you like to open up for reflections and comments to the panel, either from yourself or from our participant out there?
Thank you so much, Kari, and thank you so much for that kind introduction. There have been some changes to that, but I will come back to that later, because this is not about talking about me, but about a very important topic that has been taken up by the Center of Global Health, and really putting this on the agenda is very important. And it's also very important that you've got people on this panel from very different backgrounds, different experiences from different parts of the world. So I think the diversity in the presentations today also shows us that this is a global issue that is inclusive, where everybody is included. And I think the presentations brought that very nicely. I'm just going to I won't try to summarize now, I'll try to summarize it at the end, but I would like to raise the issue of what the panelists said. We are all aware of the challenges, and I think all the panelists in their own way, where the challenges are related to practice, research, information, there are many common challenges, regardless of where you're in the world. And it's very nice to see that this is also a challenge for Norway, because it's not just low and middle income countries that are struggling. The first thing I'd like to do is ask the panelists, and I think it would be good if everybody would respond to this question so we get started. While we're aware of the challenges, what do you see as the solution? And Agatha has been one of the people who's already told us that, you know, she would like to have the free products available, and that's of course part of the solution. The question to Agatha then is to say, how can we do it? But if we can start with Jenny and just go and say, what do you see as some of the, you know, salient or the most critical ways to address the challenges that we have, and maybe address it in your own context, because you had a very good overview, Jenny, of setting the stage. So would you like to start? And then and Joseph is also part of the solutions, but we can ask him when we come to him how he thinks his solutions can help to resolve some of the challenges. So Jenny.
Thank you, Bernadette. So, I mean, I think that the fact that menstrual health is multifaceted, so it's about access to education and information to manage periods appropriately, access and the importance of infrastructure for example, safe and discreet disposal spaces where somebody is going to be able to manage their period and not be prone to gender-based violence, for example. Spaces that don't perpetuate stigma and shame, like the workplace. So I think that access to free period products, a variety of products, is definitely the first step. We have to do more in our society to address the stigma and shame surrounding it and the way that that perpetuates it. And it does start with having conversations like this. I think one of the challenges that we have in Scotland right now, we have started to roll out our Period Products Free Provision Scotland Act, which was enshrined in law at the start of 2021. The money has been given to the 32 local constituencies around Scotland, but now the challenge we have is, how do we capture those that are lying outside the social and health and social care system? How are we working with, for example, individuals from the traveller community, people that are undocumented migrants, people who English isn't their first language, people who are living in digital poverty? We have a high level of digital poverty in Scotland, and we just actually rolled out an app which you can use to see where you can get free period products through local council owned buildings, but not everybody has a smartphone. So we need a multifaceted approach to address this. Free period products is definitely a first step because it starts that conversation. It shows people that that kind of policy, that we are serious and we need to have something that's more integrated. But there's a lot of work still to do in my native Scotland. So stay tuned. Hopefully we'll get there in the next 10 years.
Thank you, Jenny. Liv, if you could just, focus on, we know the traditional practice has been very challenging, and we have some colleagues in the Q&A. And just to let colleagues know, I spent the last 4 years in Nepal, living and working there as well. So I'm very aware of the problem and the movements that have been initiated in Nepal. But Liv, how do you see the outlook? Are you optimistic with the work that's been done? And what is needed further to make these changes possible?
Yeah, I would say I'm positive. I've been surprised at all the changes that happened just over these last few years, and even with the change in the law that it's been outlawed, then that also shapes people's attitudes, I think. But I think, as Jenny also said, I think it really needs to be multifaceted, the answer, the solution, and to involve schools to make toilets available with water. I think many drop out of school just because there's no toilet in the school. And also information about the natural cycle of menstruation, so that we can that will also reduce this superstition that is about the impurity and shame. But also, as I shared, to also involve the older women, especially when it comes to this practice of child body, I think is really important, as well as the religious leaders, because they hold a lot of power when it comes to the tradition. Yeah.
There's a question in the Q&A, Liv, and I'll just have you answer that at the same time, talking about the role of men in Nepal and what can be done to actually get their support to bring about that societal change. If you could talk a little bit about that.
Yeah, it's a good question. I think so. In our work, we worked also a lot with men, and I think that's really important for equality to happen on the whole, especially when it comes to violence against women and girls. But what we found when it comes to the choke body practice, then we found that the men are more likely to say that this practice is wrong than women. And so they could kind of support the project or to support change to happen. But for change actually to happen, we need to work more with the women, older women especially. Yeah.
Thank you, Liv. I'll come back to that issue once we've finished with the round. And I think, Agatha, I have a couple of challenges for you. And I think it's brilliant that you worked out the cost, for example, of sanitary products, what it costs a woman. I think there's the economic arguments are some of the strongest. What is also a very strong argument is the cost benefit. So would it be a good idea to get some of our colleagues to work out what will be the loss to society? Because this is the loss to women in terms of the economics, but days lost, school lost, and if one could do the calculations there, would you think that would be something that policymakers could use? That's one question. And the second question related to your presentation is really looking at, you've made a very big impact with youth here, and very good that it's, as we say, party neutral, all parties, nobody thinks about the party, but you reach out to all. What about youth across the globe? Would you think that would be good? And I think maybe we can link that up with Joseph's tool and see if that could be a way of reaching out. So those are the questions to you, Agatha.
Thank you very much for your questions, Bernadette. I also agree with you that the economic argument is very strong, and yeah, perhaps it would be wise to make a cost-benefit estimate. On the other hand, I think it's quite difficult to do that, to add all the factors. But yeah, that would be wise. I think it would cost, in Scotland, it costs around 280 million Norwegian kroners to make the sanitary products free. Here in Norway, we actually have an arrangement where you can order condoms free online, and it is sent to you by post. It's important to prevent chlamydia, which is going around in Norway. And our solution is something similar to that you can just order online if you want free sanitary products, and then the government takes the bill. That's also a way to do it, because that's already an arrangement we have here in Norway. So I think it would be easy to implement. And the other question around youth organization for this issue, I think that would be great that we can unite and show that this is an issue in every country, even in Norway, where we have, a great economy. This is important, and to stand together in solidarity to demand free sanitary products, I think that would be a very powerful movement.
Thank you very much. I think that there are several responses in the chat, and I see Jenny has also very actively asked some issue, and I think it was Joseph who's asked a question about, do you see that the access to the products is an entry point for information, or what role does information have here? Could you also discuss that?
Could you please repeat the last one? I read the Q&A while you were speaking.
Yeah. But sorry, it's in the chat, not in the Q&A.
Yeah.
It is, do you see access? Because the free cost would definitely increase access. And both in low and middle income countries, and in, of course, Norway and other countries as well. But the question here was, do you see access to sanitary products being the entry point for information, or what role does information have? So while you're reflecting on that, Agatha, we'll come back to that reflection, and maybe Jenny could also respond when we finish the round. But thank you so much for addressing this at the moment. Katarina, I'm going to ask you the classic researcher reflection, and your presentation was really insightful, and I think it made us all think, oh my goodness, we really have a lot of work to do. There's a lot of we need to find out why this is so. Why are some of the myths still being perpetuated? Why is there still the attitudes, why have they still not changed? And so it's a leading question really to what kind of research would you like to see? And I think, as you said, you and Kari need to talk, but I think it might be also inspiring for other people who are maybe planning research to, if you could just give us your perspectives on what you would like to see.
Well, I think we should do a survey. It's absolutely the best way to do it. Maybe even a qualitative study also to interview some women and maybe men too. But the reason for these attitudes, it's the traditions and myths that they are very difficult to change. Even though we know that women in Norway have a good life compared to many other countries, but and I think if we do, some of us together or somebody else does research on that, we should also, of course, include our immigrant women in such a study, because there can be big differences among Norwegian-born girls and women and immigrant women. There are many big questions. This small study that I found, it's just occasionally now for a couple of weeks ago, it's just a small hint what happens in Norway. We need much more knowledge.
Thank you for that, Katarina. There's one question in the Q&A on research and evidence. The question is from Nepal, that do you have any research evidence about the health effects of long-term use of cloth sanitary pads? And Kari, would you like to also just respond to that, because anybody who has any knowledge of any evidence regarding cloth versus sanitary pads?
So your question was posed to me and one other person in the panel.
Yeah, I was asking Katarina because there's a question in the chat which says that in Nepal, most women in rural settings still use cloth during menstruation. Can we work around this to make it a more hygienic and healthy practice? Do you have any research evidence about the health effects of long-term use of cloth sanitary pads? Again, advocacy for making sanitary pads available based on current evidence. But again, if we don't have the evidence, that's evidence we need to generate. So it comes back to, there's a lot of evidence we need then.
No, I don't think I don't believe there is any difference in health effects. But what I have understood that especially in low-income countries, it would be important to give the young women and girls pads that can be used several times, that they can wash, because then they have it. And these one-time pads that are only garbage afterwards, they are too expensive, too difficult to all the time get access to. But I don't believe in any health effects of either of them.
I just want to add in that I follow you, Katarina, and I also think that maybe not like health effects in a strict manner, but of course a social effect in terms of like that you can avoid like the long-standing smell and so on. So of course they I think just intuitively, I would think that the cloths should be replaced. And I also just wanted to add in, since you, Katarina talked a little bit with you, Bernadette, on the need for more research. I think also there should be more information about the significance of menstruation for fertility reasons, right? Because I think in many Western countries, also in Norway, there are a lot of people with involuntary infertility, and it just struck my mind that I think menstruation should be highlighted as a not necessarily something you need for being pregnant, but also that in the 16th century, menstruation blood was seen as one of the most valuable fluids in society. So I think also we could also address menstruation in a broader sense. I think this is a really educational task also in Norway, because we tend to forget this in for instance, gender equality debates.
It's just a comment,
Yes.
Kari. What I meant about the pads and the clots, that the third alternative, that they don't have anything. That was my thought. It's better to have a clot than having nothing.
Absolutely.
Absolutely right. And a very important other product which is in the market is the sanitary cups, and Joseph has very kindly put that as well for information that that's being used. So I think there are several alternatives, and I don't think the jury is out on what is best. Jenny, I see that you have your hand up, so would you like to add to that conversation?
Yes, thank you, Bernadette. I think one of the things that we also need to think about, and one of the things that I think requires a lot of attention, is the fact that the ingredients of our products aren't regulated appropriately. So I know, like the Food and Drugs Administration in the US, they have the Code of Federal Regulations, I think Title 21, which basically lists like tampons, period products such as like sanitary pads, menstrual cups under medical devices, but there's nothing in the regulations that say that they have to disclose what ingredients are in them. So we don't know if they have anything that's carcinogenic, for example, and we're putting them very close to or inside our bodies for 5 to 7 days a month. It's a bit unsettling, and I always think if men were bleeding in this sense, would we have this lack of regulation? And for period underwear is not even listed in any of these regulatory bodies. They don't have to disclose what's in it at all. So we actually don't know what's in our products. And I think that's one of the challenges that we face, is that we need to have better regulation when it comes to products, so that people have safe and affordable products. We did an event last week that talked about menstrual health in crisis, and one of the speakers spoke about menstruating women in correctional facilities in America. And one of the things that she highlighted was the quality of the products was so poor that not only were they giving people allergies and rashes, etc., but they were also not sticking to their underwear, and they were very thin. They didn't have access to all of the products that they needed because the quality was so poor. So I think something needs to be done about that as well.
Thank you for that, Jenny. Agatha, you have your hand up. The floor is yours.
Thank you. I agree with Jenny, and also in regards to the question from Joseph, it's important that the woman herself can choose which sanitary product to use, because for some it can be very painful to use tampons or menstrual cups, and for others they love it because then they can use their white pants more easily. You know, it's important that they choose themselves, because without getting too technical about how they work, they all have their ups and downs, and some like to vary from day to day, because okay, today I'll use this and tomorrow I'll use this. So that it's important that the woman can choose herself. But again, I also agree that if it's nothing or a sanitary cup, the cup is better than nothing, of course. I would also like to add that here in Norway, our proposals to make the sanitary products free for all, it has actually met surprisingly amount of resistance, and people start comparing free sanitary products with, oh, but then razors should be free because men have to shave each day, and It's like, but you don't skip school if you haven't shaved that day, you know? I mean, I don't think people do that, at least. So it's quite odd that people are so resistant about making that policy. So yeah, to also connect this to the question about information, it's very important that we show people why it is a problem. We have to tell our stories and show that it is a problem if you can't afford sanitary products. It is a problem that you feel shame about having your menstruation once a month. So we need to share this information, in that way we can have the people support. And I would also like to connect this to the question about it was the question from Victoria in the Q&A about how we can share this information when many people don't have the technology to use social media and stuff like that. So, I mean, in my organization, we also still use posters and hang them on walls around the block. And I think that's something you can do around the world, given that people can read, of course, because that's also a way to remove stigma. You know, it's normal to bleed each month. It's normal to have your menstruation. Let's gather around and demand free sanitary products. You know, we can do that in every country and start a movement. Thank you.
Thank you so much for that. And thank you for reminding us that there are choices and not one should be pitted against the other. I see that Jeanette has her hand raised. Jeanette, the floor is yours. And then we're nearing the end of our seminar. So I'll try to wrap up.
Thank you very much. This has been a very interesting and delighting seminar so far, and I'm looking forward to see what we can do next. I just want to share that in 2005, I was in New Orleans when the whole city was closed down because of the hurricane, and we had 2.5 meters up to 5 meters of water standing in the city for more than 2.5 weeks. And when it opened up, the US Army came and we got their provisions. And of course, no sanitary pads, nothing that actually was geared towards women, not even infant food. So it was a system designed for men. It is for any society, it is of uttermost importance that women have a healthy relationship to her menstrual period and to the whole situation of being in the reproductive phase, because every society we want healthy women, healthy children, we want the future. If we do not make sure that we have that, we have a major challenge in each society, and we also have a security issue for us. So kudos to all of you that are working, continue working. This is extremely important. It is about the next generation.
Thank you, Jeanette. And that was really a very nice way to summarize some of the discussion today, the issues raised, and also acknowledging all our good speakers and the insights. One issue that we have not touched upon, and I will try to summarize in 2 minutes with a very short story, and it could be a good story, Joseph, for you to use. And it goes back to Nepal, which will illustrate one of the topics that we haven't covered. So in one of the hospitals in Nepal, and for reasons of confidentiality, I will not say which hospital, but there was a particular doctor who said that on a particular day of the week, nurses who were menstruating were not allowed to work with him. And this was completely unacceptable. So one thing is, far in the rural areas, but this was an urban area. And if one thought that education would change everything, one can think again. And guess what happened? The director of that hospital said, well, then you can find yourself another job, because it is not the nurses who will have to stay at home, but you will have to stay at home. And that's why leadership is such an important thing. So when we talk about policy, when we talk about legislation, and I'm looking forward, Agatha, to see you complete your law degree and work on the legislation. I'm looking forward to Jenny and to all the other enthusiasts here, trying to make sure that the regulations come through, and looking forward to all the people on the ground, like Liv and a lot of others in the chat, making sure that we can work together on the practices. And we can't do any of this if we don't have the evidence. So Katrina, Kari, and everybody else who's been here today, you have an important job to generate more evidence to make policy and practice change. Kari, would you like to say something so that we can formally close the webinar?
I just want to echo your nice summarizing, Bernadette, and from my position and on behalf of the Center for Global Health and the gender stream, I am extremely happy that we could make this. And of course, I'm looking forward to stay in contact and see the effects of our work and research and conversations. So thank you again. It's been a pleasure.
Bye-bye.
And thanks to all of you following the
Yeah.
webinar, of course.
Thank you, Kari, for your moderation. And just to let everybody know that NACME does not exist anymore. So, and also, unfortunately, as much as I'd like to be, with the University of Oslo, that position doesn't exist. So I'm at the moment with the Norwegian Institute of Public Health as special advisor, but I'm very pleased that I'm also co-lead for the Women in Global Health Norway chapter, and also affiliated with the Center for Global Health. So thank you for that.
Thank you for the updates, Bernadette.